pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're a little late. We're starting at 10:36.
I'm not concerned.
Oh, I'm sorry.
Okay.
70.
Don't get in trouble.
Page 70, everybody.
Excuse me, ma'am, who are you?
I'm Dorothy Caldwell. I'm an elected legislator.
Legislator what?
Elect,
Oh, okay.
You're replacing Chuck, is it?
that's correct.
Okay, well, welcome. Okay, where do you want to start? You're the chairman.
I noticed. We gotta have a motion to approve the budget.
Second. Oh, no, you gotta open it, and then you gotta go through it.
Where this is go.
We have a first and a second. For discussion.
Yes. Any discussion?
Why don't we open it up for,
You gotta open up
give us a
for-
highlight.
It's my next meeting. All yours, Carol, let's go.
I'm ready to go. Finance person, okay. So, that I appreciate very much, let's put that on the record. She does a wonderful job with our budget every year. She works very hard on it, and I give her a lot of credit. Thank you, Jen, thank you. So, we can start with preschool, page 2960. This is our budget for preschool services. And this is the bulk of our budget. It doesn't have any salaries in it. It's just the services for preschool. So you'll see on here that under other payments, which is, excuse me, I think it's two different budget formats. The 546500 line, under 2960. Yep,
The
so
number again.
Other payment?
it is A2960546500. Right on page 70.
Third line down.
Yeah.
Got it.
Okay.
Page 7. Chairman, if I may, this is one of the areas of the budget I pointed out in my budget message. You'll note that preschool special education, which is a mandate, that we don't control the prices on the schools and state, schools and state set the prices and how much it's all going to cost, and they hand us the bill. I mentioned this in my budget message because it went up over about $760,000 or $780,000 on the levy. If you look at page 84, the entire net county cost increase of the health department is $900,000. So the bulk of it, all but $150,000 or so, is all in preschool special education state mandate that we really shouldn't be paying at all. It should be on the school. I just wanted to preface it. Don't blame
Thank you.
the health department. Don't blame the health department. This is state and school costs that we have to pay.
Yes. Other payment line contains all the services, which are tuition costs, your basic therapy costs, speech, OT, PT, visual, aids, and it's just as Phil said, a very costly program that we're mandated to pay.
Not much we can do about that, right?
Correct.
Frank?
Yeah, I just want, for people that, may not understand, mandated, and everybody in the whole legislative body does not like mandated projects, payments, especially when they're not fully funded by the state. So we don't have anything that we can do about reducing them, okay? But mandated projects, not our happy camper, us. if you're gonna mandate it, fund it. That's my concern. I know that we do the best we can with what we have.
I think everybody can agree with that.
Yes, I know that. I know that, you know, everybody in this whole
No.
legislative body not complains, but expresses their concerns about things being mandated and then not being funded. I have some questions about the full budget when we get into it all. Okay, so go ahead. Thank you.
Richard?
Phil, down at NISAC, is this still hopefully a hot button being talked about?
Yep.
I mean, I can't imagine out of 62 counties, we're the only ones sitting here talking about this.
It's been part of the budget lobbying and budget goals for all 62 counties ever since I've been associated, but state just won't budget it.
Now, you say
Won't
they,
change.
which is they?
What do you mean, Dave?
Well, somebody mandates this, who is
New York
that?
State of New York.
All right, the legislature, the governor, the whatever?
It's state law that these services are a county charge, even though they are determined by the schools in reviewing the case for each student, and the rates to be are set by the state.
This would have been something that we could have possibly put in when we did our budgeting and our acceptance of the new plant money and asking for more money that the, you know, school district would come up with more money. Okay, and, you know, just, you know, you gotta put that out there that, you know, when you guys do this, I won't be around when you guys redo these contracts with them, but remember what we pay, what we're collecting.
You're not gonna come back and visit?
No, thank you, Roy. No, I've seen enough and had enough fun. But I think, that, you know, we have to keep that in mind, whoever is on that committee, when you go to the table with the new plants, that you say, I'm sorry, the school district with the entities, you know, because the school districts is us, and it's the town and village, or whatever it is, okay? You say, we need a bigger share of this money because you're not picking up your portion of what our costs are, okay? So that's all. Thank you very much.
Anything else? Moving down to special ed.
Okay. 82980 is our special ed admin, which is the preschool admin staff that run the preschool program. We don't have a whole ton of changes in here. Increases were primarily salary and fringe. Other than that, a couple miscellaneous things. We needed a little bit more for postage. It's a pretty small budget.
I could backtrack for a second. Frank, to your point, Phil said that was brought up in the negotiation.
Oh, I know we, that, don't worry, they're not happy with what I kept saying.
Well, we know we had arguments over the split share. Yeah.
Right. We argued left and right over it, and what we accepted, I didn't agree with. Phil knows that.
Any questions for special ed? All right, let's move on down to health department.
Okay, 84010 is our admin department. It consists of admin staff and finance staff. Again, there's not a whole ton of changes in here. Salaries and fringe, which you'll see across the board. Let's see. A little bit more in postage machine rental. Very small changes. A little extra for envelopes. Auto supplies and repair went up about 500 because we increased our number of pool cars. A little bit, and decided to pass on some educational opportunities next year.
Yeah, is that page 73?
71, 71 through 73.
Pardon me?
71 through 73.
I got 74.
Yeah, there's a three.
Is there something?
All over the place, huh?
Oh,
Yeah.
oh, yep, it does go to 74. Thanks, Bob.
Just out of curiosity, state retirement and social security, you need to listen people. That's one of the few things that did get down.
We did reclass a position, down a couple pay grades, so that probably attributes to the social
I
security.
think you had a long-term employee retire from April and 10 here. Maybe you.
Which is 4035. No, that was from maybe you're right.
Generally, it's going to be the salaries from the previous year, so
Yeah,
somebody must have retired, or you moved somebody to a different area.
yeah, it's gotta be Sue. Oh, Sue Bray was a long time.
She was a
long time.
Okay.
Yeah,
That,
so that would be her.
So we don't have to pick that person anymore.
right.
No,
And then
that's
we
all I'm
put in a
asking.
new
It was
person, that
it was an
person
employee.
retired.
Thank you, Veronica.
Anybody else? Moving on to preventative health,
What page is that, gonna be 74?
Yes.
75.
There's my favorite spot. There's my.
This division's our preventative division. They do the immunizations and our maternal child health home visits and work with lead, among other things, communicable disease. And again, there's not a whole lot of changes to this one. They're pretty bare bones budgets. Salaries, fringe.
What's your question?
We did have to put an extra 500 in for data loggers for the refrigerators. Those were previously, the last few years, covered under a grant that we received for COVID that are now over. Increases mostly from supplies needed. And then the same thing with syringes, we had to put a little bit of extra in to buy syringes for clinic, because we had a lot of syringes left over from COVID, but we're out of some sizes, so we had to add a little bit more for that. Next year, we'll probably need more because we'll be completely out of COVID syringes.
Any questions? Richard?
This is under preventive health then. I'm looking at your lineup here. The epidemiologist, bet you can probably say that. There's a change in the wage on this by $9,000, $9,354 to be exact. What is driving that? That's quite a
They were part of
difference
the,
between 57 and 67.
they were part of the positions that were reclassified at the beginning of the year and changed pay rates. That's correct.
And it's costing us $9,000 more for this cat?
This was the wage study, yeah, due to the compensation study.
Oh, my.
We get to the rabies.
That's an environmental, so that'll be the last
Environmental,
one.
okay, all right.
Yes.
Okay. I was just waiting, I was just waiting. But, you know, I just have to bring up one thing. We're gonna be voting on the whole budget.
Mhm.
But I just don't want you to think if I vote no, it's not because I'm voting against the whole budget, because I'm voting against certain parts of it. And I won't get a second when I want to move something in here, so I'll wait till December to make my
Frank, the
motion.
intensity is unbelievable, what you're setting up there.
Well, I just letting you know, okay? All right, thank you very much. I even got Paul to smile. That made my day now. Okay,
You only,
okay.
healthy families.
Healthy Families is our Healthy Family program. It's an educational program that works with the whole family, parents and children. This is a fully grant-funded program. All expenses, except for very small portions of salary, are covered by the grant. The salary portions that are not grant-funded are related to emergency preparedness because we need them to be able to work the drills. And our program director also has some unreimbursed salary because she works with preventive families when there's a bereavement case, and she'll go and speak with the families. You'll see that this actually looks like it makes us some revenue, but it doesn't. That is due to finance staff being in there. So the revenue that looks like it's over is actually related to 84010. This program changed last year when we ended the CWC program, which is the Child Welfare Protocol, where we're taking the most high-risk children from DSF. And that allowed us to add 2 new staff members also. Positions, but continue to be 100% funded.
Rank acronyms.
I brought them up, okay, throughout the whole day, so, and I'm under the understanding that our fine people that, do this budget and put this thing together they're working on,
I didn't get it.
a way for us that are not acronym intelligent, we'll be able to find them somewhere in this budget, okay?
They're writing a project code glossary today. So that page will be added to the printed tentative budget.
So you may get some questions about what some of these projects.
Yeah, the project strings, the account
The
codes,
project codes.
the strings.
Yeah.
No.
I have a
Yeah.
comment and a question, because I know that I've been to most of these budget hearings, okay? And also within our committee meetings, people are adding their mileage reimbursement, travel, travel reimbursement is one thing, but mileage reimbursement is skyrocketing in a lot of departments. And I'm going to ask it in this department, because this department has some leased vehicles and also doesn't DSS, there's other ones that have leased vehicles. But it's kind of like, okay, well, I've got to add more money to my mileage reimbursement because people have to use their own vehicles, okay? But I don't think we use every single vehicle in this county every day. I just don't think we do.
We do not pay mileage
No, I know you don't.
reimbursement if there's a county car available.
Right, okay, that's what I'm saying, and I'm not questioning your use of the mileage reimbursement, that's not what I'm questioning that within the county, I'm sure that if, somebody needs a vehicle, there's a vehicle available somewhere, okay? It may not say health on it, it may not say assigned counsel, it may not say, not assigned counsel, but public defender on it, and it may not say whatever department needs a vehicle. Okay, but if there is a county vehicle available somewhere, okay, I think we have to start doing that versus doing mileage reimbursement, because it is costing us a lot of money. And I'm just looking to share as much as we can. And I think department heads have to start working together to say, okay, look, you know what, I'm over here in the public defender's office. I've got a public defender that's got to be out in Amboy this afternoon, and do you have a vehicle available that we can use, okay? To somebody, I'm not, the only reason I'm bringing it up now is because this is a department, this is a committee that I have a question that I can ask that and see what we can do about it. It's just, let's just keep it in mind, okay? That's it. Thank you very much.
You're next, Mark.
All right.
Legislator Greco.
That sounds like a wonderful idea, Frank, but I would err on the side of, if I'm the health department, if I'm the public defender, and I loan out my car to the health department and they have an accident with it, now I don't have a car. So as a fiefdom, having control of my own equipment, I would be opposed to loaning it out unless it was an emergency. Right, so to do it as a course of business, yeah, it's only going to work till somebody has an accident with your car, and then you're going to be without a car. So that's this. I mean, I understand what you're saying, the concept, but I don't think it will work.
Can I add to that? And just to piggyback off that, there is also that, like in our case, I don't know about other departments, but our vehicles are covered under Article 6 funding. So we have to claim that by the program that uses the vehicle. So anytime another department takes the vehicle, we don't get reimbursement for that portion of the vehicle. So there is a reimbursement aspect to it.
And then I understand it's not going to be something that's going to be easy to be done. But I'm just saying that, in order to, to save some money somewhere, okay, I think, we should start looking at it. And if a person gets into an accident with their own personal car, and it's on their, job requirement to have that car, it's gonna wind up costing us somewhere. So I'm just, it's just an idea. It's something out there. So thank you very much for your time and effort. I appreciate it. Go ahead.
I think, Frank, you bring up a good point, but part of the problem we have is we have cars that are, the sheriff has some of them, or public safety, let's put it under that. We'll put it under that umbrella. Public safety has some, there's some out of your department up at Bunner Street. Mexico has some of them. Is it gonna be, if we were like, I'll use for an example, I'm not gonna pick on Manhattan, but I will pick on Saratoga County, because I paid taxes for a long time. Boston Spa, all your county bills are in Boston Spa, right on McMaster Street, to be exact. It's easier for a motor pool to work in an area like that. Here, we're spread out a little bit more, and it's difficult. It is difficult, because now I gotta somehow get Joe Smots from her office out to Mexico. And then I gotta get him back. It's a complex situation in our county. And I won't even have to go too many miles from here, go to Oneida County. They've got office buildings in Rome, and then they have office buildings in Utica. It's difficult the way we're spread out, and it is. I understand your mileage situation. It's a complex, very complex answer to this, because there's no exact answer to it to correct it. Yes, maybe it should be better communications, but the time the car might be needed is not available, and that's a problem. And getting the person back and forth between buildings. Someone's got to get paid to do that. That's all.
I think what you're saying is it doesn't make sense that if someone at DSS needs a car to go to a meeting 10 minutes away, it doesn't make sense for them to have to drive to the health department 30 minutes away to pick up an unused car, to then drive back and go to that 10-minute meeting. Yeah, I understand what you're saying.
We do loan our cars to other.
I know I've borrowed them occasionally.
Especially overnight, it's really easy, and we can, Board of Elections just borrow 3 for election.
So in concept, it's in.
It's happening where it's operationally efficient.
Right.
So we're not using as many personal vehicles as we used to.
We don't use any.
No,
Or
it's not your
Because
department.
there is
It's not your department that I'm talking
If you look
about.
at their 2024 actual lines on all those mileage reimbursements, the only one that's even a little bit elevated is environmental, and all the rest are extremely low. Some are zero.
Yeah, they're really budgeted as a just in case that there's an accident and we need to have somebody at the farm or people in the shop.
Thank you, Ron.
And let's not forget that the IRS increases the mileage reimbursement rate every year.
70 cents.
Anybody else?
Does that Frank? Does that, does that
Public health education.
There you go, there you go.
Health education. Everybody got it?
Could be-
Okay, 84037 is our health education department. Sure, I don't have to tell you, health ed is out in the community doing lots of different education programs. They also head up our emergency preparedness program. I think the big increase this year was the stepping on, which is not that amount, but stepping on did cost this year, that cost us this year to renew. It's about $3,500, and that's every 3 years it needs to be renewed. That is one of our most attended chronic disease self-management classes. It's for fall prevention. Salaries increase. I don't think that we have anything new in this. We did have to add $300 for Constant Contact, which is the program that the educators use to send out emails to the community with updates. And
Both of those increases are on the 4037 to 543800 other fees and services. Page 78, almost to the bottom, other fees and services. Both of those increases are.
thank you. And then one other small increase we had was our auto rental, which is 544300. Probably on that same page. We had a vehicle that was allocated to that program that had gotten into an accident, and when we replaced it, we had to buy off a lot, so the cost was a little bit higher. And Health Ed also has a larger vehicle. They have a larger SUV versus the small Trailblazers that everybody else has, because they bring a lot of things when they table and go do presentations.
All right, you're gonna have to help me out. EIP.
It's early intervention program.
What's that?
Early intervention
Okay.
program. No idea why it's acronym. Put that on the budget. E. So this is our early intervention program. This is for children ages 0 to 2, where preschool is ages 3 to 5. Again, this is a mandated program. There's not a lot of change in this budget. The salary increases like you're seeing in other budget and fringe increases. We did have one position that we moved to part-time. It was a grant-funded position. The grant was no longer covering the full salary, so we moved that position to part-time. Our early intervention grant did get a $4,884 increase, which was put towards salaries. We had a small optional state program for our children with special health care needs that covered things like hearing aids and orthodontia. And it would cover those expenses at 50%, but the guidelines are very, very strict, and we haven't used it in 5 years, so we decided to remove that program. And hired a OT this year. We had a position in here last year that was a speech therapist, and we did not get any applicants. So we changed it for 2025 to an OT, and we did get an applicant early this year. And so that added an additional vehicle to this division. It was not an additional purchased vehicle, it was just a reallocation of current vehicles. So that vehicle cost went up a little.
on page 79 of occupational therapist, I think 0. Is that, oh, no, I'm sorry, never mind. That's a
Wrong
right.
line.
I need a ruler like Frank.
You want one? You want to use mine?
I'm good.
At least you're all about.
We bring
I can use a piece of paper.
we bring our rulers.
Never mind. I'm good.
Anybody else? Richard?
On page 81, bottom, I'm a little bit curious.
Jumping ahead.
Well, it's all part of that.
Well,
No,
Just that federal.
you're in the environmental.
Here, and then it goes in environmental. It's
Well, is that, yeah,
We can wait then. We can talk about it now, whatever you want to do.
whatever you want to do.
All right.
Well, let's stay on this one here. If there's any more questions, comments?
no.
Okay. Environmental health.
Now you can go.
Oh,
There you go.
God. Thank you very much, gentlemen, I appreciate it. We have these, if I understand how to read this right, I think Phil's gotten, Veronica did a good job of this. These vacant positions, environmental health aid, there's 4 of them, youth aid, there's 3 of them. I don't know what the hell you're gonna get for $360, but that's all right. What do these people do?
The environmental aides, they work at the mosquito station. They're usually,
they're seasonal.
They're seasonal. It's usually students that are college students that have summer break that we appreciate very much. The other ones, youth aides, go out and do smoking checks. Vape checks, smoke checks. They go and try to.
Oh, they're the
purchase
ones that go into the convenience store and try to get the employee to sell cigarettes to them with the false ID. I went through that, and I had to sue the state, and I won that too, on that, because.
I know, we don't give them, no false ID. No, they just go in without.
At least another.
I would not be given a.
Two regular Matlock there, watch it.
No, point, they're underage. They're underage.
You have to catch it.
They're Boy Scouts or Eagle Scouts.
They're underage,
Yeah.
and they, yes.
That's why it's such a small amount of money.
Richard, they couldn't use you.
Obviously, because they're seasonal.
So they'll always be vacant this time of
You
year.
done, Richard?
Yeah, I did.
Legislator Director. All right, so at the health committee meeting, I made a motion to move the recommended donation up to $20. I think it's about 15. After consulting members of the environmental department, I'd like to amend that. I'd like to move it back to $10. It's been advised and given me advice telling me that the $10 will keep less people from walking away and more people showing up. So our goal is to get these animals vaccinated. Although $20 to me seems like a reasonable fee, it might not be for other people. So I would like to make a motion to return the fee from 15 back to 10. Can I get a second?
Second.
Thank you.
I thought we have to do that in the health committee.
I just confirmed with Phil
We are
before I
health
brought it
committee.
up. This is a health committee meeting.
Yeah, but it's about the budget.
Yeah, that's a committee
What is
meeting.
part of that?
Does
I
that, if
think
that
you have
passes,
to wait till-
Karen, what revenue line does that come out of?
It's gonna.
It's on 82.
Donation.
7050 on page 83, so it's like,
They-
Gifts and
it's
donations.
literally
Yeah.
5 lines down, the 5th line down.
Gifts and donations.
Yes, gifts and donations.
So is the 12,200 budgeted based on that $15?
No,
Change
that
to
is
15, or
budgeted
that
based
was
on
a
the
10?
$10. Correct,
All right, so
because,
we don't need to change that line.
right. I was gonna get there.
Well, we got a motion, we got a second.
I appreciate that you went and spoke with them, and I support your amendment.
Thank you. So do I. All right, all in favor?
Aye.
Opposed? One opposed.
Thank you.
Do you know why?
You want it to be 0.
Right.
It's on for tomorrow, right?
And I'll make it on the floor, okay? The reason being, ladies and gentlemen, is the fact that, you put out there that you're gonna ask for a donation. And I know that we're not. But you're making that statement by saying that we wanna make the donation this, okay? You're saying you're gonna ask for a donation. And I'm sorry, if we put a bucket out at the beginning of the line that says for Toys for Tots, not for the vaccination that you're getting, okay? But it's for Toys for Tots, okay? That goes to something good. This is double dipping because we're getting money from the state or whatever we're getting it from, okay, to pay for this. And now you're going to say, well, you want to make a donation for getting this, then you can, okay? And I'm sorry, it's not something that's in my gut feeling. I think it's a great idea that we're doing it. Don't get me wrong, but what I'm saying is,
It's mandated.
But it's not 100% reimbursed from the state, right? It's only 60%. So
how much, how much does it cost us? I got the
state only
Watch our
covers-
committee meeting last time?
The state only covers 4 clinics, we run 8.
That's correct. The state covers all of them, actually. Two things. First, the donation buckets aren't at the beginning of clinic, they're at the end of clinic, so we don't know who donates. And second, that, when the donations that we receive are removed from any calculations of expenses that we claim from the state, so it's not double dipping.
We remove the amount that we receive in donations, and it is written into the grant that we can request donations.
and I'm not saying, my point is that we are asking for it. And we say we aren't, but we are by saying that the donation should be $10, okay?
I'll give you the 10.
No, that isn't the point. Legislator Greco, the point is that you are, if the rabies clinics cost us money, is it covered under the grant money that we get, or is it, how much does it cost us? How much does the rabies clinic cost the taxpayers of this county?
I don't have that number off the top of my head, I would have to get that.
You'd have to add up the cost of the salaried people that were there and the cost of the vaccines themselves, which has doubled.
Yeah, and then subtract the grant, and subtract the Article 6, and subtract the donation.
And the supplies and equipment that we use there also.
Okay, so, and that's what I'm asking is that if the grant money is covering the cost.
No, they said at the last committee meeting it didn't cover the
Didn't
cost.
cover
No,
those.
well, yeah, but we go beyond the original amount for the next grant. Okay,
Because
to
out of
cover.
the rabies grant, we have to pay for anyone that needs to have treatment.
Right, and then we said after we expunge all that money, we go to the next grant to
Article
cover the
6.
cost.
With the rabies
Yes.
grant, any donation money we get that covers those clinics' expenses, that's more grant money that we can use toward human treatment and shipping specimen preparation.
Large animal shipment, which is costly.
The treatment's very costly too, if I remember
Yeah.
correctly, right?
That's a service.
Very much.
I have no problem with it. I have no problem. I don't care if the state rabies clinic costs us, $10,000. Okay? That's the service that we give. That's my point. That's why I voted no on it,
Understood.
and I'll bring it up in the committee. I'm not against what you guys are doing. Okay? Don't get that idea that I'm against what we're doing. It's not that. Okay? It's the point that it's a service, and people get, pay an awful lot of tax money, and that should be covered. Thank you very much. I'll shut up so we can get out of here.
Thank you.
Well, the only thing is, and I understand the different feelings on this. I'm a big mandate person as far as if Ford mandated, and that's what we do then. If we're, we expand that. We expand way beyond what we're supposed to do.
Mhm.
And I have no issue with that. A little bit of donation is not gonna hurt anybody, because there is an expense to having an animal. I don't care how you cut it.
Yeah, but
Believe me, I've got tons of them.
But we know that probably, that 2 people out of 7 don't pay anything and a bunch of other people pay more, so. And that's just, it's gonna continue that way. It's not gonna cover it.
Legislator Greco.
just doing the mandate is not enough. We have a rabies problem in this county. You said it before, you shot a couple of raccoons. I've shot skunks, raccoons, rabid animals constantly since I've lived here. They're out there. We need to protect our animals. We need to get the baits out. It's an expense that's not wasted. That's what I'm saying. That's it. I would not limit any number of rabies clinics. Anybody else?
So we have a motion to
We already
adjourn.
passed that.
And we already passed that, right?
We already
Okay,
passed that.
good. Yeah.
I just explained my vote, that's all I did.
Well, we'll hear it again on the.
Yes, you will, don't worry.
Oh, can't wait.
So you can say that I've already heard this, so you don't mind if I, turn.
I know, you're just practicing.
Keep it under 5 minutes or I'm gonna call the question.
Oh, no, there's no
My
limit.
last
There's
act
no
of the
limit.
year.
There's no limit.
My
I got up to
act of
20
the
minutes.
year.
I have 20 minutes.
Health Committee, Seward County Hospice.
There's no more.
There's no,
It'll fall
that was
off.
the-
next year.
that was one of the best programs we had, and that young lady right there would made it that. Thank you for your service.
Thank you.
It's not under this committee.
It's not under this committee. That's right. All right, anybody else? Any questions? Looking for the proper,
No, you gotta vote on, no, you gotta vote on,
oh, I gotta vote on the budget, I'm sorry. All right, all in favor? Aye. Opposed? Looking for the.
Right, I told you so much. Oh, yeah, beginning I was voting against it. You know, kind of like telling you what horse is gonna win a race, bet on it.
You don't even bring that up. What's going on now?
I didn't hear that, so hold on.
Yeah, we got, yeah, put whoever you want.